So let us talk about this anterior abdominal wall and rectus sheath. Okay. So basically, the anterior abdominal wall, it is musculo-aponeurotic structure. As you see the pictures, you will understand better. Like that means it has muscles and also it has aponeurosis. Okay. So in order to understand this, let me show you the muscles and aponeurosis. You will understand better. See, the anterior abdominal wall, it looks like this, isn't it? So it has certain surface landmarks, like this point is actually the xiphoid process of the sternum. From here, you will say this is pubic symphysis area. This is midline area. Actually, this is called as linea alba. Linea alba. Now, on either side of this midline, you are finding like rectus abdominis muscle, which is generally called as six packs muscle. Okay, you're finding six packs muscle on the either side. And again, there is one more line over here, which is linea semilunaris. Linea semilunaris. Just now, I told you in the previous lecture, like this area, the thickening what we have is inguinal ligament. From the anterior superior iliac spine to the pubic tubercle, we have inguinal ligament. Okay. So, and we usually divide the abdomen into 9 regions, right? So, like, let us see, that means musculo-aponeurotic. Once you remove the skin, you will see a lot of fat in the superficial fascia. That is actually called a superficial fatty layer, also called as camphorous layer, and deep membranous layer, also called as scarpa's layer. Once you remove the fat, there is no deep fascia in the abdomen because abdominal organs should move freely. Okay. So then you have the first layer muscle, which is external oblique. Musculo-aponeurotic in the sense, posteriorly we have muscle fibers, anteriorly we have only sheet of fascia where muscle fibers are missing. Hence you call it as musculo-aponeurotic. This is muscle and this is aponeurosis. Musculo-aponeurotic. Musculo-aponeurotic. Both the sides, that is the same muscle we have, that is first layer. Once you remove the skin, we come across external oblique muscle. If you cut the external oblique muscle, second muscle what we see is internal oblique muscle. If you cut internal oblique muscle, we will see transversus abdominis muscle. Once you remove transversus abdominis, all anterior layers, see here 3 lines are shown: external oblique, internal oblique, and transversus abdominis. External, internal, and transversus abdominis. Midline, rectus abdominis. Everything you have removed, then you are finding the abdominal organs are covered by means of a fascia. The name of this fascia is fascia transversalis. Okay. Once you remove fascia transversalis, you will see big peritoneal covering all internal visceral organs, stomach, intestines. Nothing is seen because there is a protective cover around it. We call it as peritoneum. Okay. Peritoneum itself, we will discuss much in detail. That is actually very interesting topic. So with this some like background knowledge, now let us see the introduction points which you will understand. So now coming to the anterior abdominal wall. So now it is musculo-aponeurotic structure. I hope you understood now because it has muscle and also aponeurosis. It is confined to anterolateral aspect of the abdomen. So above we have xiphoid process. On either side we have costal margin. See, this is one costal margin. This is one more costal margin. Isn't it? Below we have this pubic symphysis area. More laterally we have this pubic tubercle and also we have pubic crest. And this green line is actually indicating inguinal ligament extending from anterior superior iliac spine to the pubic tubercle. We have inguinal ligament. Okay. Now, so each side of the separated from the posterior wall by mid-axillary line. So if you just observe this picture, 3 transverse lines are shown. One line is passing below first lumbar vertebra. We call this line as transpyloric plane. This itself can be a 3 marks question. Transpyloric plane, the plane which is cutting the abdomen horizontally below the level of first lumbar vertebra. We call it as transpyloric plane. Okay. Now, between L2 and L3, there is one more plane which is called as subcostal plane. And above the level of fifth lumbar vertebra, we have transtubercular plane.
Transtubercular.
So we have transtubercular plane. Then see here, everything is written here. Now coastal margins, see this is coastal margin, which is cutting which rib? 7th, 8th, 9th, 10th ribs and coastal cartilages. Okay, that is. Now, linea semilunaris, six packs muscle, just now I told you rectus abdominis, right? On either side of that muscle, whatever red line is shown, we call it as linea semilunaris. So it is curved furrow extending from the tip of ninth costal cartilage to the pubic tubercle. Okay. Then lines few centimeters away from median furrow, there is actually lateral margin of rectus abdominis. This we will understand as we proceed with the remaining thing. Now, McBurney's point is also a 3 marks question. Don't read anything, first try to understand. See, McBurney's point is a point which is generally palpated. Palpation means we just press and see. We are now pressing the abdomen at certain point to check if there is any pain in the lower abdomen, if there is any case of appendicitis, appendix inflammation. So in case of appendicitis, we generally do palpation at McBurney's point. So what is this point? So this is umbilicus region and this is anterior superior iliac spine. So you draw one line moving from anterior superior iliac spine to the umbilicus. So the junction of medial 2/3 and lateral 1/3. This is medial 2/3 and this is lateral 1/3. At the junction of medial 2/3 and lateral 1/3, if you just press, you will see the patient will kink with pain. So that pain is due to appendicitis. At this point at the junction of medial 2/3 and lateral 1/3, okay, the line extending from the umbilicus to the anterior superior iliac spine. Okay, so base of the appendix usually lies at this point, hence we call this point as McBurney's point. We usually palpate to check if there is any appendicitis. Now next we have one more point which is called as Murphy's point. Okay, so Murphy's point is, see, I said this is linea semilunaris on either side of this rectus abdominis muscle. So the point where linea semilunaris is meeting the subcostal margin on the right side is actually corresponding to the tip of ninth costal cartilage. Okay, there we usually palpate to check if there is any pain in this region. This will be painful if the person has any cholecystitis, inflammation of gallbladder. Okay, fundus of gallbladder lies deep to this point. Okay, so Murphy's point can be 3 marks. McBurney's point is repeated 3 marks question. Repeated 3 marks question. Now let us see. See, I said transpyloric plane is 3 marks question. Where is it cutting? What is the other term we have for transpyloric plane? It's also called as what? Addison's plane. Isn't it?
Yes, ma'am. Hello. Hello.
Now see, transpyloric plane is at the lower border of L1, isn't it? So you can see here, it's an imaginary horizontal plane which is passing through midpoint of the line joining the suprasternal notch to the symphysis pubis. Okay, it lies about 1 hand's breadth below the xiphisternal joint. If you just keep your hand like this below this point, 1 hand breadth below xiphisternal joint. So anteriorly it passes through the tip of ninth costal cartilage, posteriorly the lower border of first lumbar vertebra. So it's an imaginary horizontal plane. Okay.
Yes, ma'am.
So this is now. Actually, there are certain changes which happen at transpyloric plane. Here you will see the pyloric part of the stomach is there. The hilum of right and left kidney where we have entry and exit of structures it corresponds to. There we have the gallbladder also, which you should know what are the structures we see at transpyloric plane. Now subcostal plane, where is it? Below, between L2
Horizontal
and L3 we can see, say, so subcostal plane.
subcostal plane.
Yeah. Say horizontal plane passing immediately below the coastal margins. So it is passing through the lowest border of coastal cartilages of 10th rib. Okay, and posteriorly it is corresponding with third lumbar vertebra. At the level of umbilicus, if we cut, we generally call it as trans-umbilical plane. So you can see the umbilicus here. Okay, it is between L3 and L4.
Yes,
What are
ma'am.
the other planes? Intertubercular plane. If you remember the hip bone, we have iliac crest, and just 5 centimeters behind the anterior superior iliac spine, we have the iliac tubercle. So at the level of tubercle, if you just cut right and left tubercles of the iliac crest, you call that plane as intertubercular plane.
Yes, ma'am.
Okay. It is passing the intertubercular plane or transtubercular plane. It is passing across which vertebra? L5 vertebra. Okay. Then, so just now in the previous point, I have shown you two vertical lines also. To divide the abdomen into 9 regions, we have two vertical lines. From where do we take that? Mid clavicular line, right and left mid clavicular planes. Okay, that is. Now coming to what are the various layers of the abdomen we have. So what are the layers now? Just now when you have seen, like I have shown you different pictures, right?
Yes, ma'am.
So you are finding anterior abdominal wall will have certain layers. You should imagine as though you are doing dissection. So first layer you come across is skin. Below skin we have superficial fascia. Below superficial, I told we do not have deep fascia in the abdomen because we have visceral organs which are actually need a free movements. If deep fascia would have been there, the movements have been restricted and specifically deep fascia. So after that, we have anterior wall of rectus sheath, rectus muscle, posterior wall of rectus sheath, and peritoneum. Everything I have shown you. Okay.
Yes,
On the
ma'am.
lateral side, see, first thing you come across when you do the dissection is skin. Okay. So what is this line? I said linea alba. From this default,
Yeah.
yeah, to the pubic symphysis linea alba. Once you remove the skin, we will see the superficial fatty layer. Actually, superficial fascia will have two layers. Superficial fatty layer, also called as camphorous layer, and deep membranous layer, which is also called as scarpa's layer. Okay, that is the subcutaneous tissue. Once you remove that skin superficial fascia, then we will come across muscles. What is the first muscle we come across? Masood?
External oblique.
External oblique abdominis. Okay. What is the second muscle we come across?
Internal oblique.
Internal oblique abdominis. What is the third muscle? This is the third muscle. This is also third muscle. What is the third muscle we come across?
Transversus abdomen.
Transversus abdominis. And in the midline, are you finding we have one more muscle?
Rectus.
Excellent. Rectus abdominis. Lower
Yes.
down, can anybody name this muscle? It is looking like a pyramid, hence it is named as pyramidalis. Pyramidalis. Okay. So all these are the muscles of the anterior abdominal wall. Now you have removed all those muscles, then you will come across there is one fascia. The name of this fascia is fascia transversalis. Okay, fascia
Hmm.
transversalis. Once you remove the fascia transversalis, we will come across peritoneum, which is the protective covering around the abdominal visceral organs. Okay, then let us see on the medial side of the anterior abdominal wall. Again, we have this same layer. Skin is there, superficial fascia. Okay, the same thing you are finding. What is this middle line? Abhiram? Anyone? Midline, white line, linea alba.
Linea alba.
Alba.
Linea alba. What is this line on either side of rectus abdominis? Anyone?
Left and right hypochondria. Left pubic, left and right pubic.
Linea semilunaris. Okay. Got it? Middle line is
Yes.
linea alba. On either side, the
Alba.
line is linea
Semilunaris.
Semilunaris.
linea semilunaris. Okay. Second layer we have is subcutaneous tissues.
Subcutaneous tissues.
So this is anterior wall of rectus sheath you are finding. If you cut this sheath inside, you will see rectus abdominis muscle. See, here sheath is cut. Inside which muscle is seen?
Rectus.
Rectus
Rectus
abdominis.
abdominis.
What is this lower down muscle?
Pyramidalis.
Excellent, pyramidalis. You can see how we have cut this anterior wall of rectus sheath, isn't it? Then rectus abdominis you have removed. Rectus abdominis is no more there. You are finding posterior wall of rectus sheath, isn't it?
Yes, ma'am.
If you see, suppose rectus abdominis muscle, it will have anterior wall. Okay. Once you remove anterior wall, you will see rectus abdominis muscle. Once you remove rectus abdominis muscle, you will see posterior wall. Did you get the idea?
Yes, ma'am.
So inside the rectus sheath, you have found the rectus abdominis muscle and also blood vessels and nerves, right?
Yes, ma'am.
So let us name them, like the artery which is coming from above, you call it as superior epigastric artery. And the artery which is coming from down is inferior epigastric artery. Superior epigastric and inferior epigastric. Do you remember superior epigastric is a branch of which artery? Anyone? Internal thoracic artery. Okay?
Yes, ma'am.
Internal thoracic artery. Okay? So, like that you are finding. So, this is peritoneum. Once you remove peritoneum. Now, let us see. When we talk about the anterior abdominal walls, summarize the names of muscles fast. Masood, what are the
External oblique.
Abhirab.
External
External
oblique.
oblique.
Internal
Pyramidal.
oblique.
Oblique.
Internal oblique.
So, rectus abdominis. Pyramidalis.
Rectus abdominis, pyramidalis.
Yeah.
Internal oblique.
Yeah, external oblique. You should come in order.
Transversus
I told you
abdominis.
such a beautiful order, no? You should follow that order only, please. First muscle we see is what? External oblique.
External oblique.
First muscle we see internal oblique.
Internal.
Third muscle.
First can be transversus abdominis.
Transversus abdominis.
Then rectus muscle, pyramidalis.
Rectus abdominis. And then we have pyramidalis.
Pyramidalis.
Okay. Now all these are like critical aspects, like you see, this is external oblique abdominis muscle. You are finding its origin is coming from this 5th, 6th, 7th, 8th, 9th, 10th, 11th ribs. Those are postal cartilages, and muscle fibers are found only on the posterior aspect. Anteriorly, we have only sheet of fascia, which is called as aponeurosis, which is actually forming the anterior layer of rectus sheath, like this, covering the rectus abdominis muscle, isn't it?
Yes. Yes.
So you can just read like the origin insertion of this muscle. First muscle we have is external oblique. Okay. So it is fleshy. It has 8 digitations coming from the like lower 8 ribs, like this. You can see this 1, 2, 3, 4, 5, 6, 7, 8. Then we are finding insertion. So where is it? The muscle is inserted. So in this whitish sheet, what do we call it as? Aponeurosis. So not only that, you will see some of the fibers. Black line is shown. It is getting inserted into the outer lip of iliac crest. Okay. Then the aponeurosis of external oblique muscle. So actually, you can tell like linea alba, this like whole, isn't it? From the xiphoid process to the pubic symphysis we have. So that is all insertion of first muscle, external oblique abdominis. Okay.
Yes.
So this lateral part of this one is the lateral part of this muscle is actually folded backwards. I'll show in a next another picture. Inguinal ligament.
Yes.
Actually, the lower part of this muscle actually folds on itself to form this. Actually, I'll show you now that because that is very, very important. Now see here. This is whole muscle from the anterior view. Which muscle is this?
External oblique.
External ob-
External oblique. This is anterior view and this is lateral view. This we are seeing
Yes.
from side and this we are seeing from front, right?
Yes. Yes.
Yes,
Seeing
ma'am.
from side in order to understand the origin, lower eight ribs and all. This we are seeing in front to understand the insertion. This is linea alba, aponeurosis, right? Where it is getting inserted here. Now the lower part of this external oblique muscle is folding on itself. It is just folding
ma'am.
like this. It is folding lower part. It is folding on itself and it is forming one ligament. What is the name of this ligament? It may be wrong, but try please. అప్పటి నుంచి చెప్తున్నా కదా ఈ లిగమెంట్ పేరు. అభిరామ్, మసూద్,
Yes.
సాత్విక, వైష్ణవి, you can write.
Ligament name, ma'am.
Yes. Thickening of this muscle is actually forming inguinal ligament. What is this ligament? What?
Inguinal ligament.
Inguinal ligament. Okay. So inguinal ligament is the modification of which muscle? Tell me. Aponeurosis of which muscle is folding to form?
External oblique.
External oblique abdominis is folding on itself to form inguinal ligament. Okay. That is what is the last point here. See, lateral part of this muscle is folding upwards and backwards upon itself to form inguinal ligament. What is the extent from
Yes.
anterior superior iliac spine to pubic tubercle?
Yes.
Yeah. See the direction of muscle fibers. How are they directed? Downwards, forwards, and towards the midline, hence medially. Isn't it? The nerve supply of external oblique is intercostal nerves T7 to T11.
Yes. ma'am.
Okay, T12
Yes,
is subcostal nerve. That's why I like when we were discussing thorax, I told you T7 to T11, they are called as thoraco-abdominal nerves because they not only supply thorax but also they supply abdomen.
Yes.
Okay. Now, let us see the second muscle. What is this? Internal oblique
Internal
muscle.
ob-
Internal oblique muscle.
So internal oblique muscle. Now see, this is the internal oblique muscle. Fibers are quite opposite to what 90 degrees. They are to the external oblique. How they are coming, you can see.
Yes, ma'am.
Isn't it? This red line is all like it is coming from thoracolumbar fascia.
Yes, ma'am.
It's coming from the iliac crest and also it is coming from inguinal ligament. And then the muscle fibers are moving forwards and again same point. They are getting inserted into the linear. Let us see the origin insertion. Internal.
Abdomen.
Second muscle.
Posterior of 10 to 12.
If you cut external oblique, second muscle, you see internal oblique. Okay. So now let us see the origin. Anterior 2/3 of the intermediate line of iliac crest, this green line. This is our ilium bone, hip bone. Anterior 2/3 of the intermediate area of the iliac crest. Lateral 2/3 of the inguinal ligament.
Inguinal
Behind
ligament.
this area, this gray area is thoracolumbar fascia. Okay, that is
Yes.
the origin. Insertion. See this dots. Lower 6 costal cartilages. Okay.
And their adjacent
Xiphoid process
12th ribs.
and the linea alba. Okay. So and also the pubic crest. This.
10 pubis.
Okay. Then next, now see the direction of fibers. It is upwards,
forward,
forwards,
medially.
and medially. Okay. Something like 90 degrees to external oblique abdominis. Okay.
Yes, ma'am.
Nerve supply. Same T7 to T12. Subcostal is not mentioned separately. It is told in continuation. We also have nerves coming from lumbar plexus like iliohypogastric and ilioinguinal nerves, which supply the second muscle. Okay. What is the third muscle we have?
Transversus abdomen.
Yeah, transversus abdominis. See, transverse in the sense all fibers are running transversely. Nice horizontal
Yes.
lines. See the origin? Same thoracolumbar fascia, inner lip of the iliac crest, and posterior 1/3 of the inguinal ligament. This whole ligament you are finding green in color is inguinal ligament. Okay, insertion
Yes.
is also. So let us see. No. Transversus abdominis muscle. So transverse direction muscle fibers. Lateral
Yes,
view
ma'am.
and anterior view. We are finding. So coming from the lower 6 costal cartilages. Okay. Then also thoracolumbar fascia. Okay. Then anterior 2/3 of the inner lip of the iliac crest. Okay. And lateral 1/3 of the inguinal ligament.
Ligament.
These are points of origin, insertion. So this is xiphoid process. Okay. Then this is pubic crest. So this is called linea alba. We know this midline. From this process to the pubic symphysis, we have linea alba. How is the direction of fibers? Now you tell me.
Transverse.
And
And they are running in straight line, horizontally,
Yes.
isn't it? So now coming to nerve supply. Same thing, T7 to T12,
T7
iliohypogastric.
to T12, iliohypogastric and ilioinguinal.
Now, next up, a muscle, six packs muscle we have, rectus abdominis. Okay. Now, see here. You are finding these are the costal cartilages which are shown in blue. Fifth, sixth, seventh costal cartilages. Okay, and the origin is like it is. This is like hip bone, right?
Pubic crest.
Pubic crest we have and pubic tubercle we have. So it has medial head and lateral head. Okay. So from there you see it is extending between the costal cartilages and this point. And throughout the muscle you are finding some green wavy lines which are actually called as tendinous intersections. Tendinous intersections. What is this
Intersections.
ligament in green color? What is this ligament you are finding here? Masood? Same.
This inguinal ligament.
Inguinal ligament. From where till where it extends?
Uh,
From anterior, please tell,
Anterior superior iliac spine to medial head.
to pubic tubercle.
Lateral head from pubic crest and pubic tubercle.
Very good, very good. So now see rectus abdominis muscle. So it is coming from this point, that is pubic
Pubic
crest.
crest.
Okay. Insertion is this point, fifth, sixth,
Seventh.
seventh costal
Fifth.
cartilages. Okay, you can see origin medial head, lateral head. They arise from this pubic crest, pubic tubercle. The fibers move upwards and they get inserted into fifth, sixth, seventh costal cartilages. Okay. Not only that, you will see it is also getting inserted into the xiphoid process. Okay. Now, rectus abdominis muscle is divided into segments, no? 1, 2, 3, 4, 5 segments by this transverse lines. What do we call them as?
tendinous insert.
Tendinous intersections.
Tendinous intersections. That six packs, what usually the film heroes show us, they are actually, these are nothing but the elevations
The
which
rectus
are produced
abdominis.
between the tendinous intersections. Okay, which indicate that muscle is arising from number of myotomes which are fused together. This actually also increases the muscle strength. Okay, so surgical importance, segmental nerve supply. Every segment has its own nerve, like dermatomal rule what you have. Now suppose if there is any bleeding in that one particular segment, it will not spread to the other segment. That means hematoma in the rectus abdominis muscle is localized. Then this is the paramedian area. Linea semilunaris, I said that area, that is the, if you give cut while surgery, you call it as paramedian incision. Okay, it displaces the muscle laterally. So nerve supply comes from lateral aspect. You can see the nerves are entering from lateral to medial. Like this, the nerves are entering. Arrows have been shown. What is this small muscle, pyramid-like muscle, right and left side?
The
We have,
pyramidalis.
yeah, it's a landmark of this linea alba. Okay, intraoperative. Action of these muscles. See, whatever expulsive movements we do, coughing, sneezing, breathing, delivery of the baby, micturition, parturition, defecation, all these are actually like because of the action of these anterior abdominal muscles. So they assist in raising intra-abdominal pressure. So they help in vomiting, cough, delivery, etc. They keep the abdominal viscera in position. Are the intestines just popping out? No. Is the stomach popping out? No. All this because our tone of the muscles is quite good. If we don't have muscle tone good, we usually suffer with hernias. Okay? That means these muscles are actually keeping the abdominal viscera in position. Okay, so rectus abdominis flexes the trunk while two oblique muscles bend the trunk laterally. Okay. So these are accessory expiratory muscles, all these muscles. Now,